My name is Jenna Hopkins. This is part 2 in my Living with Long COVID, the Wizard of Oz solution. My part 1, I went through the introduction and explained that in order to treat, you need to screen and treat for all of these symptom clusters. The very first one that we're going to go into depth discussing today is going to be post-exertional malaise. I have other videos out discussing this. This is definitely the first thing that you want to screen for when you are working with long COVID, and it's the first one that you want to control, because if you are stuck in this push crash cycle, it is not only a cycle, it is a downward spiral. So what that means is that your system will get more and more sensitized, and you will be causing more and more body damage if you are in this push and crash energy cycle. I used the DePaul symptom questionnaire in order to basically diagnose post-exertional malaise. It's got a lot of good research behind it. Let's discuss the definition of post-exertional malaise. This is when symptoms such as disabling fatigue or exhaustion, difficulty thinking, pain, exercise intolerance, and other symptoms are made worse by exertion. Exertions include physical, cognitive, emotional, social, and sensory. People are unable to produce sufficient energy on demand. If you are positive for post-exertional malaise, graded exercise should not be used as it is harmful for recovery. Post-exertional malaise is characteristic amongst those with myalgic encephalomyelitis, chronic fatigue syndrome, or ME/CFS. So people with post-exertional malaise need to learn to stop prior to symptoms starting, resting sufficiently prior to returning to activities, and pacing the activities they perform by breaking activities up into tolerable pieces. There is no way to get around this step. You have to learn how to do this, and this is what I'm trying to do as an occupational therapist for people. There is research out that just came out last week. It has, thank goodness, blown up in the news as long as you've been paying attention. This was a very small control group, but a very well done study in which they took people that were recovered from COVID and people that had long COVID with post-exertional malaise as a symptom, and they did muscle biopsies before and after exercise. The people who had recovered from COVID showed what should be expected to happen, and the people that had long COVID basically showed damage. So the big thing was that the mitochondria are compromised, the tissue was starved for energy, and basically that muscle tissue was damaged. It showed a disturbed immune response and a buildup of microclots post-exercise. This is very real. So, there has been a lack of research. I'm so glad that somebody went and did this study, because finally, instead of just showing that people are exercising at different capacities 24 hours later after an exercise test, we can show they are basically trying to exercise on damaged tissue. So it's like running with a broken leg. That's not what you want to do. I highly recommend anybody with post-exertional malaise to do a very thorough medical workup. The Bateman Horn Center has an excellent resource with recommended testing. It's tiered testing, meaning that they do kind of A level, B level, C level. You want to go through the A level testing first and basically rule out the basics. And if all of that comes back normal, then you can move on to the rarer and rarer conditions. So please visit this site and take advantage of this resource. You want to do the lifestyle management, but then also once you are stabilized, then it's time to start talking about medications and supplements. This information is from Mayo Clinic. The first line medication that they recommend is basically NAC daily with guanfacine at night. They include the dosing guidelines right here. What you need to remember is that this first line medication is not going to be good for people that already have lower blood pressures, lower heart rates, or anybody that is my Dorothy or is in that hypermobility camp. The second line medication is low dose naltrexone. And again, they give information here about the dosing guidelines, but just so you know, it takes about 2 to 3 months to show an effect. So it's not something that's going to be a quick and easy. There's some herbs and supplements that have positive outcomes in ME/CFS, and I've got dosing guidelines and the supplements right here. Again, I'm not recommending people basically start all of this all at the same time. You might want to add in a few things at a time to double check and making sure that it is not creating an issue in your system. Nattokinase is something that, unfortunately, if you do have the MCAS, if you're a scarecrow, then that might cause issues in your system. So if you feel badly after taking that, then please stop. You can discuss maybe taking lumbrokinase as an alternative. Additionally, we want people to be on probiotics, but because probiotics are something that can also irritate people with MCAS, we'll cover that in the MCAS section as well. Okay, here is another resource from the Bateman Hormone Center. This is about post-exertional malaise crashes and how to manage them. This resource is more for people that have moderate to severe post-exertional malaise, but the thing that I like about it is it does talk about basically crash kits. I thought that was something that was really useful, which is basically all the things that are helpful to you, all of the helpers kind of gathered into one bag where you can have it in the car just in case you need to go to the hospital, or if you are on a trip and out and about and you actually need everything. And then, also having one in the home. So it's kind of like you're not having to waste energy to gather all those things together. The other thing is somebody with post-exertional malaise, I really highly recommend that they have a wearable device. At a minimum, I want you to be using the Visible app, and that is not as good as a wearable, but it's at least a snapshot into how your biometrics are for the day. Preferably, you have a wearable device that you're really using, because that's really taking a video in terms of responsiveness. So I would love it if people had something that shows heart rate variability and resting heart rate. And then continuous heart rate monitoring, I think, is the best thing, especially if you're somebody that has dysautonomia symptoms too. Some examples include Garmin, Apple Watch, Fitbit, and Oura Ring. And I really like the Facebook group Beat Long COVID with a Smartwatch, because it gives you advice about how to set up and interpret your wearable device. You basically want an activity floor, which is your minimal amount, and then your activity ceiling, a max amount. So you want to make sure that you're choosing an activity that does not cause any symptom flare-ups and isn't causing crashes. So everything should be low to moderate. And there is also a newly released wearable device called Stat Health, and that helps with positional tolerance. It's really expensive though, so it might only be for more extreme cases unless you got money to burn. But I want you to know what you're getting into and what this is all about. So there is a link to a video here by the founder. That's about an hour-long video. So make sure you know what you're buying. Then I've got the heart rate maximums up here as well. So if you are a man, a woman, or on beta blockers, the formula is going to be a little bit different. And just know these are suggestions and not prescriptions, but it's about half of your max heart rate. Okay, so the formulas are right there. If people aren't sure or don't want to do the math, then I say try and keep your heart rate under around 100 beats per minute. And that makes sure that you're less likely to have that post-exertional flares. For people that are not willing to get one of those wearables or that can't afford it, I do recommend that Visible app, and that will give you a morning stability score. If you get a 1 or a 2 for a morning stability score, that is a red zone, watch out. So you want to take frequent rest breaks, avoid triggers. You still want to sit up consistently throughout the day, either supported or on an exercise ball. You can do breathing exercises, calming activities, and then you aim for your floor in terms of your activity level. With a 3, you want to aim for your average activity level, frequently check your vitals, check in with your body, use pacing principles. And then if you get a 4 or a 5 for that morning stability score, that indicates a slight increased tolerance for activities. I really want people initially to not think that this is a green light. It's basically a yellow light plus, because we're trying to get you stable. So after about 1 to 2 weeks of stability, you can start to aim towards a ceiling and then add in autonomic conditioning therapy exercises. I've got some videos on that. You can also continue to monitor your system for 48 hours to make sure you're able to recover from these exertions and not get back into that push crash cycle. So we want to make sure that the HRV and stability scores are trending up, demonstrating a tolerance for growth. So that is the quick and dirty on post-exertional malaise. I've got 45 minutes of videos explaining more about post-exertional malaise and how to help to reduce your activities. So if you are interested, I will include those in the playlist below. Our next video is going to be about hypermobility and Ehlers-Danlos syndrome.